everyone, today I will be showing you the proper donning and doffing of the personal protective equipment. Now prior to the procedure, I already put my head cap and my shoe cover since it was not included in the checklist. So first is the proper use of the personal protective equipment. Now as we all know, personal protective equipment is the equipment that will protect us from the user against health or safety risks at work, especially at the hospital. So first thing we have to do is to prepare the equipment. We need to gather all the appropriate equipments and prepare them before doing the procedure so that we can do our task efficiently and save time and effort. We have here isolation gown, sterile gloves, face shield, face mask, alcohol, head cap, and shoe cover. Next is to remove the cover from the isolation card if necessary and set up the work area. So this is to minimize the risk of spreading germs and pathogens that we can transmit to the patient. Next is to perform hand hygiene. So you can either wash your hands or just use alcohol and spray it on your hands. So this is to prevent the spread of microorganisms that we have on our hands. So next is take the gown and allow it into fold in front of you. So put the gown and wrap it around the back of your uniform and make sure it overlaps and completely covers your uniform. And then tie the strings above, tie the strings on your neck, tie on your waist. Next is to place the face mask. So if you don't have an N95, you can use face mask. So hook it into your two ears. Now if the mask has a metal strip here, you just have to squeeze it so that the mask can fit to your nose or to your face comfortably. The use of face mask is to avoid transmission of any airborne particles or airborne microorganisms that we can get from the patients or from our surroundings. So next is to wear our face shields. This is to protect the wearer's eyes from impact hazards such as flying fragments, objects, large chips, or particles. So you're just gonna place it like this. Next procedure is the gloves. So we are going to do a closed gloving. Now put the gloves on using closing method and fold them over the cuffs of your gown to cover the edges of the gown sleeves. Now, surgical gloves or clean gloves are used to eliminate potential hazards in the glove procedure. Now, this is the final look for donning of personal protective equipment. Next procedure is the removal of the personal protective equipment. Now, during the removal of the personal protective equipment, our goal is to avoid any contamination of the self to the environment or from the patient. First thing we need to do is to remove our gloves. So we're going to remove our gloves using the glove-to-glove method. So first thing we have to do is to grasp the outside part of the gloves and then grasp it into the other hand and then using your ungloved hand, pull it from the inside and scoop it. And then throw it to the proper container. Next is the removal of our face shield. Now, during the removal of our face shield, we only need to touch the handles or the grips only because the front part of our face shield is the most exposed to our client. And then discard it properly. And then next is the removal of our isolation gown. Now, unfasten the ties from your neck and from your back. Grasp it from the inside. And then you have to cover the outside from the inside. And then roll it. And then discard it properly. Next is the removal of our face mask. Now, you just have to remove our face mask very slowly to avoid any contamination. And then discard it properly. Next is to perform hand hygiene. So it is important to perform hand hygiene before and after any procedures that we are going to do to our clients. So next is the proper disposal of our used PPE. Now, when the PPE is worn and removed, we have to place it or discard it. We have to discard it in the proper garbage so that we can avoid any cross-contamination to any microorganisms. Usually, the garbage cans for infectious things are colored in yellow or orange. So that would be all for my donning and doffing of the personal protective equipment. Thank you for watching.